Hi there, this is Jan Strong. I am a respiratory therapist with Nightingale. And today we're going to talk about when to use a nebulizer versus an inhaler. Okay, we're going to get started here. I'm going to show you guys some things. Had a lot of questions about this. So I'm really excited that we can post this video up there and you can watch it whenever you want. Tell your friends too. All right, heroes, here we go. Again, my name is Jan Strong. I'm a respiratory therapist. And we're going to talk about when you might want to use a nebulizer versus an inhaler. So we're going to start by talking a little bit about each one. So let's start with inhalers, because almost everybody has one of these. This inhaler is called an HFA. It's not the same as your dry powder inhalers, maybe your Advair or Symbicort or something like that. It's a little different, but it has two things inside of this cartridge. It's the medication itself. This one happens to be like an albuterol, a generic albuterol. You may have something else. It's the medication and it's a propellant gas inside of it. That makes the spray come out even, kind of soft, and you want to make sure that the medication is mixed with that propellant. So that's one reason you shake it. Hopefully everybody's using a chamber. This is just one kind of chamber, and I want to tell you, for all the products I'm showing you today, I don't work for any of these devices. I don't support any of them and get paid for any of them. This is just a disclaimer to say this is the equipment I'm going to show you today. You might have a different brand. Hopefully you're using something that's FDA recommended and it's not just an over-the-counter something that you bought. You got to kind of be wary of things that aren't officially designated for medical use. So your doctor will have a brand they can suggest to you. Your pharmacy for sure will have a brand they can suggest for you. Your home care company, wherever you're getting any of your devices from, supplies, make sure that it's something that's okay and it's really going to work well. All right, so a chamber. A lot of people are surprised when I tell them this fact right here. You get up to 80% more medication if you use an anti-static chamber with your inhaler. Yeah, I said that, 80% more. The reason is if you're just using your inhaler, when you're putting it in your mouth, you're pushing it, a lot of that spray just goes to the back of your throat, on your tongue, on your teeth, and so you don't really breathe in all the medicine there is to breathe in. So if you use a chamber, you have a better chance of getting more medication. The chambers that your doctor will use or will recommend are anti-static. Basically what that's saying is that it's made so when you're pumping the medicine inside of the chamber, it's not sticking to the chamber. It's actually going to hover around inside of here and give you a moment to be able to breathe it in. So you want to use a chamber. I understand if you're just have a pocket and you don't have a bag to put it in or something like that, you might sometimes want to carry this for rescue. That's better than nothing. But if you're just at home, try to use a chamber with your inhalers. Okay. So we know to shake it. We're using a chamber. Why would I prefer a nebulizer over this? Using an inhaler, you have to have the right technique, right? Research shows that technically this is as much medicine as a nebulizer. 10 or 15-minute treatment with a nebulizer, a couple of puffs with your inhaler. So technically, research shows you can get enough medicine with this as this, but the problem comes down to technique and ability of your lungs to be able to breathe it in correctly. Right? Remember I talked about we have to pump it. It's going to hover around in here a minute. You have to know that you have it in your mouth. You don't put your lips or your teeth in front of the mouthpiece. You have to let all your air out before. Put your lips around it. Get your tongue and your teeth out of the way. Pump it. Take a nice, slow, deep breath in, and then hold your breath as long as you can for up to 10 seconds. So it would look something like this. let your air out, give yourself a couple of minutes to recover if that makes you short of breath before you do your second pump. So that took a little bit of coordination, right? I had to pump this. I had to make sure I wasn't in my own way. I had to take a nice, slow, deep breath in, hold my breath. That can be hard for people, even if they don't have respiratory disease, to coordinate all that, okay? When you have a respiratory disease where you're kind of short of breath, it's kind of a challenge to take a deep enough breath and to hold your breath long enough to kind of picture that medication settling down into your lungs. Because if you're short of breath, holding your breath is hard to do, right? That is why people that have more severe lung disease or are sick, anything like that that's making them short of breath or cough or anything like that, they actually might do better with a nebulizer. They might do these several times a day, and they might use this just for rescue when they're out and about. The reason this would be rescue versus this is because technically you could do a couple of pumps and have your medication that's starting to open up your airways immediately versus something that takes 10 to 15 minutes to get that same medication in. So it's considered rescue, but it's the same medication. And if you're just sitting around, it's not as dependent on your coordination, your shortness of breath, and all of that to do a nebulizer. People with more severe respiratory disease will usually end up doing a nebulizer several times a day. So one other thing, and then we're gonna talk nebulizers. This review your pamphlet that came with your chamber, which I just dropped, and it will tell you how to clean it. You basically can just with these, just take them apart here like that. This one doesn't even recommend that you take off this end piece. Soak it in a little soapy water. You're going to be cleaning all this stuff I'm showing you today with just like some Dawn and some warm water, like you wash your dishes. Then you want to rinse it really good, dry it out, and make sure there's no tap water on anything before you put it in your mouth. One thing that you want to remember is we never want to inhale tap water into our lungs for any reason. Okay, tap water, lungs, not a good idea. If you're going to rinse it with some kind of a water and you need to use it before it's dry, make sure it's distilled water only. Distilled water is what you see for all respiratory equipment. For rinsing it, it's because it's the closest thing that you can get to sterile that you can buy at your grocery store in a gallon. So keep some distilled water on hand in case you want to use it, this or any of the nebulizer cups that I show you in a minute. Make sure you use distilled water, but don't inhale that tap water. All right, so we've gone over chambers. I think that you guys are going to be much better at these now. It's always something that people are interested in and they don't get enough education on. All right, let's talk nebulizers. So nebulizers, and I'm going to show you this nebulizer cup first. This is kind of one that you might have gotten in the hospital before or in your doctor's office. So nebulizers turn liquid medicine. This is called a bullet, a nebulizer bullet, and it's full of whatever medicine the doctor wants you to have. Sometimes you might have more than one, and you might do one treatment and then put in another medication and do another treatment, and then maybe even put in another medication and do another treatment. When you're sick, you might have more medications than just one, or your doctor might put you on a regimen that has you do more than one. Okay, so take this nebulizer bullet, open up your cup, squirt it in, put the top back on. You're going to plug it into your nebulizer. This is just a tabletop nebulizer. There's a couple different kinds. I'm going to show you another one. This is probably the one most people have. It might be a different brand, but basically they're little air compressors. That's all they are. They're not fancy. Just sucking in the room air and these side vents and coming out this tubing in one way. So this does not get contaminated if you're sick. The air pushes all out this way. When you plug it into your nebulizer, you've put this together in the right way. Look at your packages if it's a new nebulizer. This has this little green baffle that lifts out. And if that's not in there right, any of them, then they're not going to nebulize correctly. So this is what it should look like. You can hear and see that mist. If you're hearing some gurgling or some boiling noise, it usually means two things. Either it's too full, you have put more than 3 milliliters in here. You can't just pile all your medicines in a cup usually because it might be too much liquid. So if you're hearing that gurgling or bubbling, it's usually too full or you don't have the pieces in there quite right. You shouldn't hear gurgling or bubbling, and you should see that nice fine aerosol mist. So the nebulizer turns this medicine into an aerosol mist. The mist particles that come out of here have been researched, and they're small enough to get down deep into your lungs. And you have to have the right size micron particles to be able to go down deep into your lungs. So that's why, again, you want to use something that's approved, not something somebody's selling out of their garage or something. You know, there's lots of crazy things out there. So use something approved. So you have other kinds of nebulizer cups. This is kind of more of a disposable one. And then you have some that you'll get at home with your nebulizer. This is called the Aero Eclipse. So it's very, very common one. So we're going to take this one off that you might see in the hospital off of the tubing. And I'm going to put this neb cup on that you guys might have. And the reason that you might get this for use at home is because it's a higher grade plastic, medical plastic. It'll last longer. That one's kind of considered disposable. This one is kind of considered to be used for maybe up to 6 months. Again, look at your equipment that you have, read your pamphlet. They might suggest in 6 months or so you throw this away and get another one, but you can wash it over and over again. Whereas this one is kind of thought of to be a little more disposable. So this one lasts longer. So I've hooked up my tubing to my nebulizer. Let's see if I have the right amount of medicine in here and if it's working. Nice fine mist. I can hear it's not gurgling or bubbling, so it's working great. This would be one of the most common nebulizer cups that you will see. So remember, as we wrap up talking about tabletop nebulizers, they plug in, they're just little air compressors. They're actually taking the room air out of the room through here, putting it out through this tubing, compressor tubing. And one other thing is there is a little filter in here, kind of looks like an earplug. A lot of people never know that, right? They get this, they have it for years because it's simple and they work forever. But there is a filter in here. And if you think about it, it's sucking in the air out of your room. And if you have a dusty environment, your house is dusty or just over the years, you're going to want to take this out and change the little filter. Some filters might be over here on different brands, but when you get this in a brand new package, you should have a pack of filters. So you're going to want to change it occasionally. You don't have to change it that often. Some of them are washable. Read the directions for your brand, but that there is a filter there so that the room air coming in will catch it and you're not just breathing in the dust. All right, I think we've covered tabletop nebulizers pretty well. I'm going to move really quick to another kind of nebulizer. This is called a vibrating mesh nebulizer. There's several brands out there. This one is an Omron, but I know that some people in this group have different brands because I've seen them post them. This one and the other one is a vibrating mesh. Basically, take this apart. These are complicated. These are not simple like these. They're complicated. They're expensive. They break down more often, but they have these little pieces. This is called the vibrating mesh nebulizer, one of them. They have to be put together just right. This little piece can tend to break and cost just maybe $60 just to replace this. They're really great as far as getting that medication into small enough particles to get deep in your lung, but they're expensive. Your insurance probably won't cover it, but they're battery operated, or you can even plug them into your car if you have the adapter. But watch this and listen. whisper, right? Maybe you can't even hear it. It's just almost silent. You can take it on the go, got batteries in it. If they were more reliable, I would suggest them for everybody, but they just have a tendency to not work for a long time without needing replacement parts. So keep that in mind. If you want to pay, if you can pay out of pocket for it, so you can take this along with you. They work great, but they're kind of touchy. All right, to get a nebulizer, you might need a prescription from your doctor. You can go online sometimes and make sure it's a good one that you're ordering from a reputable company. You might be able to order a nebulizer without a prescription, but if you've got a respiratory disease, your doctor will give you a prescription for one if you ask, and then your insurance will probably cut. You get it at the pharmacy, you can pick it up. Your home care company, if you have a DME company, they'll have a certain brand that they can deliver or ship to you. So how you get it, just make sure that you're buying a reputable brand that your doctor is okay with. That's it. So let's see what else. Oh, there is one more thing I want to say about nebulizers. People ask, do I have to wear my oxygen? Because this is room air and it's not giving you extra oxygen, it's not an oxygen concentrator. If you have to wear oxygen 24/7, yes, you need to wear your oxygen while you're doing this. This will only be the same amount of oxygen in the room, in the air around you, which is almost 21%. So if you have to have that extra oxygen, just keep your cannula on while you're doing your nebulizer treatment. I wanted to mention something about face masks. I know some people like to have face masks. They are not recommended unless you're a small child or you're super weak and frail and you cannot hold this to your mouth. The reason is, even though our nasal passages and our nose are part of our respiratory system, if you have a mask on and you're breathing with your nose, this medicine is going to get all caught up in your sinuses before it gets down into your lungs. It's another passageway it has to go through. You do not get as much medicine. Face masks are not recommended. So if you can use this mouthpiece, do so, you'll get more medication. And when you're breathing out of a nebulizer, okay, it's not going to be those slow, deep breaths like with your chamber, right? You're never going to want to breathe too hard on any of these things because it'll just hit the back of your throat. And if you're doing a nebulizer treatment, just breathe normally, maybe every few breaths, hold your breath for just a couple of seconds. Do your treatment nice and slow. If you got somewhere to go and you're huffing and puffing on it, you're not going to get the medicine where it needs to go, and you're probably going to make yourself dizzy. So just relax, do your whole treatment. When it starts to sputter, it's done. And then you know that you've gotten all of your medication. Do you have to wash this in between medicines? Let's say you do 2 or 3 medications. Nope, you don't have to wash it in between, right? It's all going in the same place. If you're using a medication where you have to rinse your mouth out, then do that at the end. I think we covered everything. Let me see. Yep, we did. How often do you use your nebulizer? Sometimes people end up doing it 3 or 4 times a day. Morning, lunch, evening. Sometimes the medication you get will be say to use every 4 to 6 hours. Sometimes it'll say to use every 6 hours. Your doctor will tell you how often you should use that medication. But remember, if you're doing this albuterol and then you're doing this albuterol, you're doubling up on it, and you shouldn't really do that. It might make you just a little bit shaky. It's usually a muscle thing, right? It's relaxing your muscles in your lungs, and it can kind of make your muscles a little loosey-goosey for a few minutes. It doesn't necessarily indicate that you're having a bad reaction to it. It can happen to just about everybody. I hope that I covered everything today. Again, that was when to use my nebulizer versus my inhaler. And my name is Jan Strong. I'm a respiratory therapist. And we hope that this video really helps those people on the COPD and Asthma Heroes Facebook page. Thanks again for joining me. I'm Jan Strong, and we will see you next time. Bye.